Um, so in life, as in healthcare, it can be very beneficial to understand the cultural background of the people to whom we relate. So in this cross-cultural perspective session, we have two speakers. Our first speaker is Mimi Look, and she is a life coach and motivational speaker with a degree in education and in law. 4 years ago, Mimi's friend donated his kidney to her when she needed a transplant. And she was very grateful for this, so has paid that forward as a passionate promoter of kidney disease awareness and organ donation ever since. Today she's here to speak to us about cultural considerations for Asian patients with CKD. Please join me in welcoming Mimi.
Thank you very much, Heather, and thank you to all of you for being here on this day 2 of BC Kidney Days. I'm thrilled that you're all sitting out there and enjoying your breakfast and having your coffee, I'm sure. So today I will be speaking on cultural considerations as it pertains to Asian patients with chronic kidney disease. Also, I will be discussing how Asian cultural beliefs affect perceptions about organ donation. It's not shifting. Oh, okay. Thanks. So the two learning objectives I have today is to understand the different challenges that Asians face with chronic kidney disease, and second of all, to appreciate the special needs of Asian kidney patients and what they require in terms of education and support. So I'm going to start off by just sharing a bit about my personal story, intertwined with some Asian perspective. So I'm Chinese. I was born in Hong Kong. Moved to Canada as a very young child, to Calgary of all places, where it's extremely cold. And I remember seeing snow for the first time at the age of 6 and thinking, what is that? But I grew up in Calgary, and my brothers and my parents, in fact, my grandparents, are all born in China. So it was interesting because I actually grew up in a very, very traditional Chinese family. Although because I was young, I became quite Canadianized. But in terms of eating and food, it was definitely Chinese food all the way. And just to give an example of what a typical day of meals would be like, for those of you who are Chinese or Asian, you'll probably can identify a bit. But breakfast could be congee, which is basically made of white rice and can be rather bland sometimes. Lunch might be noodles. That's quite common, is to have a bowl of noodles for lunch. And dinner could be 1 or 2 bowls of rice, maybe with a meat dish and a vegetable dish. And I know you dietitians out there are squirming in your seats and raising your eyebrows and going, no, 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 no. That's awful, because that's all carbs, of course, and starches, which turn into sugar. And indeed, 25 years ago, I was diagnosed with diabetes. So, you know, when you eat like that day after day after day, and unfortunately that's not uncommon for a lot of Asian families that don't know any better, that's sort of what can happen. And so one of the things is just educating people, kidney patients, Asians in general, to prevent diabetes, which leads to kidney disease. So I was diagnosed, as I said, 25 years with diabetes. And then in 2011, I was diagnosed with kidney disease. And I found out that my kidney functions were at 28%. And I remember being really, really shocked and thinking, wow, what's this all about? And until that happened, I knew nothing about kidney disease. to be honest, I didn't know where my kidneys were until that happened, which sounds crazy, but it's true. I forgot my high school biology, I'm sure. But boy, did I find out a lot about it once I was diagnosed. Unfortunately, my kidney functions actually failed quite quickly. By January of 2012, it had gone down to 19%. By April, it went down to 18%. And that's when my nephrologist said, Mimi, you have to think about dialysis. And I'm thinking, what is dialysis? So, he said there's 2 different kinds of dialysis, and I'll get the nurse to explain all that, but just giving you a heads up that you have to start thinking about it. And he said, though, and he emphasized to me that the best treatment, though, is not dialysis. The best treatment is if somebody can donate their kidney to me. And I remember very clearly that I felt very numb. I was obviously very emotionally upset. And my first thought was, my family, I can't ask my family to donate a kidney to me. There's just no way. And I think that as a female Asian, growing up in this very traditional family, I was raised with the idea that I always have to consider the needs of my family, not my needs. It's always, not what Mimi wants or what Mimi needs, but what the rest of the family wants and what the rest of the family needs. And self-sacrifice, it's a virtue. So it was never about my needs, and that's how I grew up. And I thought, well, there's no way that I would want to have a chance of putting my family in harm's way by donating a kidney to me. And I thought, well, this is going to be really difficult. And how do you ask for a kidney? How does a person say, can you please donate a kidney to me? I mean, it just wasn't in my realm of reality, and certainly my own Asian upbringing made me feel not worthy of that I wasn't as important, and there was certainly an element of shame as well that, wow, I did this to myself, so I don't want anyone else to possibly be harmed by my own actions. So there was a lot of conflict during that time, for sure. And I remember walking out of that doctor's office just shaking my head, what am I going to do? How do I go about this? But I was very blessed because one of my friends in Seattle actually stepped up and volunteered to donate his kidney to me. And I never asked him. I happened to be in Seattle. He's from Seattle. And we were just meeting up briefly. And he just asked me, hey, how are you doing? And so I had to tell him the truth. I said that I'm not doing so well. I'm pretty sick. And I had an appointment with my doctor a couple of weeks ago, and he tells me my kidney functions are now at 18%, and that I need to, start thinking about dialysis, or I need to hopefully be able to find a donor. And, without hesitation, he actually said, I'm really healthy. Let me donate my kidney to you. And I remember looking at him in complete disbelief because I was just telling him how I was doing. I wasn't really expecting this to happen. And so I actually tried to talk him out of it. I said, you know what, I think you need to think about this. I think you need time. I don't want you to rush into anything. Give yourself time. You're American. I don't even know if you can donate your kidney to me. I have to go back to Vancouver and talk to my nephrologist and find out if I can even donate, if you can even donate your kidney to me. I said, no. Like, really, that was my initial reaction. I just said, no, and isn't that interesting, right? Because it just reflects my state of mind, which is, I don't really deserve this. I don't want to harm him. I don't want anything to happen to him. And so I struggled with that a little bit, and then I said, look, here's what I'll do. I'll go back to Vancouver and I'll talk to my nephrologist and I'll find out if you can even donate your kidney to me and what the process is, and then we'll talk about it. And he said, well, do it right away. I want to do this right away. I was saying, okay. So I came back and I ended up meeting with Sharon, who's out there somewhere, and found out, yeah, it's absolutely fine for an American to be donating his kidney to me. And off we went on that path of testing. And miraculously, it was actually a very quick process for me. I was very fortunate because we started testing in July, and I was done testing by September, actually, and approved by October, and had my kidney transplant December the 3rd, 2012, so almost 4 years ago. So very, very grateful for that. Thank you. I mean, that's the ultimate gift, isn't it? I mean, I remember him saying to me that, if he can give me a second chance at life, at a normal life, and if he can keep me here a bit longer on this earth, then it wasn't even a question for him. And I think that's the kind of generosity that's really unspeakable, but, it's very humbling when that happens. And so I just want to say and add that he's Caucasian, and when I tell the story to Chinese BCKD patients, they're always shocked because that doesn't happen that much, that a friend donates a kidney to an Asian CKD patient. So they look at me as a bit of a strange anomaly, I think. They can't really understand that. And the fact that he's Caucasian and not a relative, because between spouses, it's way more common. But just a friend's it's not even a boyfriend, not a life partner, he was just a friend. And so that explains, that whole attitude explains some of the cultural differences, right? Which I'm going to get into a little bit later. So now with that, I'm going to go to our first polling question. So I think we all know that 1 out of 10 Canadians have kidney disease, but which of the following communities are not considered to be a high-risk group for kidney disease? So if you can bring out your computer and put that in. Are they Asians, South Asians, Aboriginals, African Caribbean, Hispanic, or Caucasian? Which of the following communities are not considered a high-risk group? You guys are really smart. Can't fool you at all. That's exactly right. Caucasians are not in the high-risk group, but everybody else is. Aboriginals, Asians, South Asians, African Caribbean, and Hispanic communities are all high-risk groups for having kidney disease, as they have higher rates of diabetes and blood pressure, the two biggest risk factors for kidney disease. So because of the fact that diabetes is very prominent in the Asian community, I just wanted to give you some interesting facts. So 60% of diabetic people in the world live in Asia, 60%. And 113.9 million adults have diabetes in China, which is 11.6% of the adult population. And actually, it's higher than that, but I just didn't have time to change the slide. It's actually much higher than now, and it's almost 30% of the adult population. So it's 1 in 3 that have diabetes. And I have to think that a lot of it has to do with diet and exercise. So by 2030, without intervention between China and India combined, they're going to have almost 500,000 people that will have diabetes. And also in the States, it's a growing problem amongst the Asian Americans as well, because the risk of diabetes is 18% higher among Asian Americans than white Americans, and for sure diabetes is the leading cause of kidney disease and kidney failure in the United States. So that's why I talk a bit about my own eating habits when I grew up. So I think we have to address the issue of diabetes and preventing diabetes in order to prevent kidney disease as well. So as I've already talked about, diet and exercise are so important with that. Food is such a big deal, right, in the Asian culture, definitely with the Chinese population. And every special event is, any chance for celebrating, we'll celebrate with food, right? I mean, we like to go for dim sum, we like to have those buffet dinners, those 10-course banquet meals, right? If you've been to any of them, especially around Chinese New Year time. Eating is just such a part of our culture. So that being said, dietitians and professionals speaking to Asian CKD patients really need to get to them at their level, which is to focus on Asian foods, because if you're talking to them about, I don't know, doing a spaghetti and meatball dish, well, they probably don't eat spaghetti and meatball. So it has to be relevant to them, and then they can change their grocery shopping habits, they can change their cooking habits. And yesterday, I was really pleased to go to the dietitian's breakout session. How many of you were there? Raise your hands. Yeah, that was great, right? So Renee Chan is a dietitian and a cook, and she did some cooking demonstrations with Chinese food, and she had all sorts of strange Chinese vegetables, right? And it was so much fun, but that was perfect. I mean, that's exactly what we need to do, is to educate the dietitians, who can in turn tell their patients, well, you can't eat this, and you shouldn't eat this, and this is high in potassium, this is not, and just really focus in on that. Renee's really great. Actually, she had done a cooking demonstration for the Kidney Foundation as well earlier this year at a Chinese New Year workshop that we put on. And what we did was we brought in a Chinese-speaking nutritionist, and we brought in Renee, and the whole workshop was done in Chinese. And it was so popular, the room only held 50. It filled up so fast that we had to take a waiting list, and we knew next time we had to have a bigger room, because that worked really, really well. And these patients, they actually got up and all stood around the table watching her cook. They were so excited about it. And but that's one thing about the Asian culture, is this love for food. So if given an opportunity like that, it's really great for them to be able to learn good cooking and healthy foods. So so that was a lot of fun. Went back the other way. So exercise, a lot of Asians don't like exercise. So even just encouraging maybe gentle exercise like Tai Chi or Qigong might be perfect for older patients or patients who don't want to move around too much or have strenuous activity. But for those CKD patients that want more strenuous activity, may I present dragon boating, because we have a kidney team called O2P. I don't know if Jenny's out there. And this team is great. I joined it 6 months after I had my kidney transplant, because I had actually dragon boated competitively prior to getting sick. So I found out about this dragon boat team, and I was so thrilled. And there are all sorts of people on this kidney team. We've got nephrologists, we've got kidney dialysis nurses, we've got transplant patients, we've got dialysis patients, social workers, dietitians. It's great. And we're happy to have more people join us. So if you want to join us, or you have patients you think might enjoy that, that's a really good form of exercise. And what's great about that is that it's a team effort. And also, you have to do it twice a week or once a week, or you have to routinely do it. So it's nice for patients to be able to develop that routine and just to get out in the social atmosphere where they're supported. So encouraging exercise is a really, really important thing. So another thing I want to talk about is social attitudes and cultural beliefs of Asians. So the idea of saving face, I'm sure you've heard of that term before, but to save face is to retain respect and to avoid humiliation at all costs. And Wikipedia defines it as taking action to ensure that one is not thought of badly by his or her peers. So understanding this very prevalent social belief explains how Chinese CKD patients may be ashamed of their diagnosis and not want others to know about their medical diagnosis, let alone ask for help. And certainly that was my situation. I mean, when I was first diagnosed, I didn't tell anybody. I told my family, but that was it. I didn't tell any of my friends. I kept it a secret for as long as I could. And the thing is, I looked fine on the outside. Like nobody knew unless they saw me try walk up the stairs because I couldn't do it very fast, if at all. Towards the end, I was actually just the day that I went in for my kidney transplant and they did the blood tests, I was operating at 5%. So prior to that, I had no energy, but if I was just sitting there for dinner or going out for a movie, I looked really normal. And so, this idea of asking for help is not something that's easy for Asians. And here's another phrase that you've probably heard as well. Do not wash your dirty linen in public. So, what does that mean? That means when something disgraceful happens that could be harmful to your family name or the family, Chinese people would rather repress their feelings inwardly than speak out, for fear that if others knew, they would lose face and be ridiculed. And this can go to very extreme behavior in trying to, again, save face. And so, again, this feeling of disgracing the family even that you've got CKD, or like, what's wrong with this person, that type of a thing. And now we come to our second question. What is a common belief in Asian culture about organ donation? A, living female kidney donors won't be able to get pregnant after they donate their kidney. B, after you die, the whole body needs to be intact in order for you to go to heaven. C, it is invasive and almost rude to have organs removed from a body after death. D, Buddhists believe that a person who died can only have a second life if that person had done good things and literally died in one piece. And E, all of the above. Go ahead, get out your little devices and vote.
Mimi.
Okay, you guys are way too smart, right? So yes, absolutely. All of that is very true. So, oops, I think we skipped one. So Asian beliefs about organ donation is this idea of wholeness of self as a deterrent for kidney donation. And it's not just the Asian culture, the South Asian culture, Aboriginal culture, also has the same idea of just keeping your body intact. So with that kind of a struggle, with that kind of a concern, how do we address Asian cultural beliefs and overcome concerns about kidney disease and organ donation? Well, education. Educate, but educate in an efficient, culturally sensitive manner to foster learning and change in attitudes and behavior. What to do? Educate both the young and the old. The elderly probably won't change their mind, but you can change the minds of the young people. So talk more to the young people who are probably much more open to these discussions about organ donation. engage Asian politicians, cultural leaders, and celebrities to promote kidney awareness and organ donation. The more talk that's out there, the more it normalizes the issue for Asian people. And if they see someone that they are more talking public about it, then they will follow suit, hopefully. Have educational materials, webinars, workshops in Asian languages, as I mentioned before about the Cantonese workshop, cooking workshop. It's very successful, but language is key so that they can understand what's going on. Encourage family conversations about organ donation, emphasize the goodness of organ donation, have support people who speak Asian languages to assist CKD patients one-on-one, because they may not want to talk in a group setting, the whole saving face idea, so the privacy issue, and organize social activities conducted in Asian languages to foster interaction between the CKD patients and their families. So just to summarize, cultural beliefs can change not only from one generation to the other, but with appropriate education, guidance, and support, can change within generations. So thank you very much for listening.